Welcome, my name is Molly DeLong. I've been a registered dental hygienist for more than 15 years, and today I want to talk about a topic that I feel is so important for dental professionals, especially dental hygienists, and that is vaping and tobacco use and its impact on oral health. So let's dive in. Ask yourself, what oral health issues have you observed in your patients? Tobacco use remains the leading cause of preventable disease in the United States. In 2022, the CDC reported over 49 million, or 1 in 5 adults reported current tobacco use. As most of us probably know, vaping is on the rise, especially in our youth. In 2024, the CDC reported that e-cigarettes were the most commonly used tobacco product among middle and high school students. E-cigarette marketing is targeting our youth through social media influence such as TikTok, Instagram, Snapchat. The Journal of American Medical Association reports 58% of youth smokers are vapors. That is a large number. Recognizing oral sign is essential for our youth to prevent long-term damage, whether from general tobacco or e-cigarettes. I'm sure some of these photos represent some of the patients you've seen in your chair who have been tobacco or e-cigarette users. I personally have seen patients present like every single one of these photos. So a few topics I want to focus on today are the ingredients we see in tobacco and vaping liquids, the impact we see on oral health, as well as how we can assess patient risk and communicate strategies through patient education to help these patients strive for a better overall health, beginning with their oral health, because as we know, the mouth is the portal to the rest of your body. So let's unpack that poison. There are more than 7,000 chemical components found in cigarette smoke, hundreds of which are harmful to humans. I've listed a few cancer-causing agents here, such as arsenic, benzene, chromium-6, cadmium, formaldehyde, and polonium-210. Carbon monoxide is another ingredient in tobacco, which, as we know, is harmful to the body, and when inhaled, decreases oxygen carried in red blood cells. This is why we see active periodontal disease in smokers with less bleeding than you might expect for the advanced disease we're seeing. Those 6mm pockets that may not bleed on probing, but then once we get in there have very active bleeding when we are scaling. Nicotine, which is that highly addictive substance in tobacco products that keeps people coming back for more. And finally, tar, which leaves that very difficult to remove stain and residue on their teeth, as well as fingernails and in their lungs. Now let's unpack what's in e-liquid. It's very similar to that in tobacco. However, vaping liquid that also contains nicotine is often found at a much higher amount than tobacco products, making it that much more highly addictive. Heavy metals such as tin and lead are also found in e-liquid. Flavorings such as diacetyl, propylene glycol, several cancer-causing chemicals that you will also see in tobacco products such as formaldehyde. You're going to see many similarities, but at different potencies than tobacco products. We see so many impacts on oral health with the use of tobacco and vaping. This photo that I have shared here is actually a picture of oral squamous cell carcinoma on the lateral, kind of more so lingual side of the tongue. This is a malignant tumor and is caused by tobacco or smokeless tobacco use or very high alcohol consumption. So it is a preventable type of cancer. Other oral lesions we may see are leukoplakia, which can become malignant in 3 to 6% of people, nicotine stomatitis, and black hairy tongue, which if you've never seen black hairy tongue, it is a sight. Not something you necessarily want to find in the chair. Periodontal disease is also very prevalent in tobacco users. I have seen countless patients that look like this with these class 3 furcation areas and those posteriors, and these are extremely difficult to treat even by a periodontist, and usually these types of bone loss and furcation involvement do end with poor prognosis. So it's important to catch these things very early on. The oral implications of vaping are very similar to that of tobacco use. One of the noticeable differences is the incipient caries that we see. We don't see that as often with smoking or chewing, but anterior incipient decay is very common in vapors. I see this a lot in patients of mine who are young, preteens, high school age, who's probably have not shared with their parents that they are vaping, but you can see here some incipient decay in this 22-23 area, 25-26, and those lesions are so common in vaping from all of the added flavorings that's in the vaping liquid. Also, the xerostomia that is caused by vaping can lead to those decayed areas as well. I want to touch on pouches such as Zyn because I think they're something that many people who want to quit chewing or smoking are kind of turning to because they are advertised as nicotine-free in many cases. There is not yet enough evidence on some of the oral impacts of these pouches, such as links to periodontal disease, but we definitely see soft tissue damage and progressive recession in patients like this. I have had some patients who are so proud of themselves for giving up chewing tobacco and thinking they're nicotine-free and doing all the right things, but are unaware of the soft tissue damage that still happens. So as you can see here in this kind of upper vestibule area of number 6, just tissues that have been stripped from holding those pouches in there. So how do we define high-risk patients? Ask specific, non-judgmental questions about their use. Look for signs like stains, odor, unusual gingival presentations or lesions. Subtle tissue changes or recession patterns can be red flags. Effective communication is key. Using open-ended questions, expressing empathy, active listening, and helping our patients connect their habits to their oral health goals. And don't preach. For example, instead of "you should quit," ask, "what concerns do you have about vaping and your oral health?" I think we have all seen vapors or smokers in our chair that no matter what we say or how we educate them, until they are really ready to take that next step, it's very difficult to convince them that what they're doing is causing too much damage to their mouth and ultimately their overall health. So we really just need to be open to listening to our patients and helping them in the best way we know how. We know as dental hygienists that education must be tailored for the patient. So with teens, highlighting aesthetic issues and leveraging social media to really get that point through on the damage that may be caused by those vaping or tobacco use. For long-term adult users, connecting those symptoms to their habits and other systemic issues we may see to really drive the point home, and really making use of things like our intraoral cameras. Visuals are a fantastic way to educate our patients and help them see results that they are striving for. And when they do finally take that step to quit, be sure to praise their efforts. Let them know you understand that it's a really challenging journey and that really deserves some recognition. So to wrap up, smoking and vaping harm oral health. We know that. They raise the risk of gum disease, dry mouth, lesions, and cancer. Nicotine-free does not always mean safe, so keep that in mind. Early identification helps prevent irreversible damage, and how we communicate these risks really matters to our patients. There are many free options out there to support our patients. I've attached some resources to this slide. Many of these quit lines provide free nicotine patches, gum, which for those who are maybe financially strained, those are great alternatives to kind of help them get through this really tough journey. Here is my list of references. And thank you so much for your time and dedication to our profession. Please reach out if you have any additional questions or want resources for yourself or your patients. We're doing good work. Keep it up.